Let's talk more about Matthew Lani's story. Bring in the Health Department spokesperson at national level, Foster Mohale. Foster, very good evening to you. Good to have your time. So I don't know if you've seen, there's an interview now by a man who's apparently Matthew Lani's legal representative who says that he did not impersonate a doctor. He is not a doctor. How does the department react to that?
Good afternoon to you and good afternoon to your audience, and thanks for this opportunity. I was not connected by that time, but with regards to the case of Lani doctor, the bogus Dr. Lani and any other practicing personnel who's not registered with the health professional council of the country or any other health profession in the country, we want to welcome the arrest of this fake bogus Dr. Lani, and we believe that this will send a strong message to other bogus doctors or health professions, because we believe that it's not alone, and also not doctors, but even other professions like your nurses, your dentists, and your pharmacists. So we believe that this will send a strong message that we don't tolerate any form of crime, corruption, or criminal activity. Except
that's not convincing, though, Foster, saying that you don't tolerate any kind of criminal activity, because even the unmasking of this bogus doctor was done by people online. Had that not happened, he may possibly have been walking through the hallways of Hill and Joseph or any other hospital undetected. So you are basically not in control of the situation. You don't have a handle on it.
Look, we cannot deny that, but hence we call upon other sections of the society, members of the public, to help us as the government to report all these bogus doctors to the Department of Health, to Health Profession Council of South Africa, to police, SAPRA, or the nearest health department, because these people, they put the lives of our people at risk. So we appreciate the efforts by members of the public who come forward or who anonymously report such a bogus health professionals. So yes, we believe that, we admit that as the government alone, we cannot do enough, because these people, they operate within the communities in which we live. So hence we call upon all the leaders and the members of the public to join hands with the government, to join hands with the law enforcement agencies in order to report such criminal activities.
But as things stand, Foster, neither the health department at national level or the provincial offices have any idea of how many people may be roaming through public hospitals or any other facility claiming to be a doctor, claiming to be a nurse, without qualifications.
Look, yeah, you might be correct, but what we can confirm is that even if these bogus doctors or nurses or pharmacists, they manage to go into our health facilities, they will never have an opportunity to attend to our patients, precisely because our healthcare workers, they work in a team, they know each other. There's no way that a bogus doctor, unknown professional, can go and start attending to help patients without being introduced formally by the manager, the nursing manager in that particular ward or in that particular health facility. So in terms of access, yes, we welcome a number of people, the service providers, the patients, the families in our health facilities, especially during the visiting hours. But in terms of them seeing or attending to our patients, that one is not easy.
That's outside, that's within the confines of the hospital, but we're hearing this particular young man was even dispensing medical advice to people because they believed, based on his social media following, whether that's wise or not, because technically you shouldn't be taking medical advice from someone on TikTok, see a doctor, consult directly. But there's nothing stopping people from doing that without being caught, or at least the department following up on its own without someone else bringing it to your attention, is what I'm trying to say.
Look, we do conduct our random both announced and unannounced inspections at health facilities, both in private and public. So hence, last year alone, we conducted about 2,700 inspections. We managed to nab around 120 persons who were practicing as doctors without registration, which SPCSA. Also, the SA Pharmacy Council, they've confirmed that they've removed about 4 pharmacists, and they were banned for about 15 years not to practice as pharmacists because they violated the conditions of their licenses or certificates. So yes, we cannot do alone without the members of the public, without law enforcement agencies and other stakeholders. Hence, we call upon members of the society to say, please join hands with us to root out these criminal activities, because these bogus doctors and other health professionals, they put the lives of our people at risk, because, as I said, they are not operating in vacuum. They operate within the societies, the communities in which we live.
Another problem, though, with the government response from the initial condemnation of Matthew Lani when he was unmasked basically by people who said he was a bogus doctor. Wits then issued a statement saying they had no knowledge of him as having studied medicine there. There was, of course, the HPCSA statement, etc., which also basically said he was not a qualified medical practitioner. The government, during COVID-19, had used him as one of the medical professionals who were encouraging people to take COVID-19 seriously, etc. And if you guys, and I say you guys as government as a whole, were unable to detect that this was not a legit doctor back then, it's a very worrying scenario, because you wonder what else has slipped through the cracks.
Yeah, no, we have used a number of influential people during the COVID-19 to encourage people to take a vaccine because it saves lives. Not only him, but the fact of the matter is that he has not seen or attended any patient in our health facilities. So we have used people from
my point, though, Foster, apologies. My point is that government basically took someone who it now says is not a doctor, used him for a campaign as a medical professional. Whether he tended to patients or not is beside the point, because it raises questions about what sort of screening went into that influencer campaign. Did you simply look at the number of followers and targeting reach instead of making sure that the people you were using were actual credible medical professionals? That is a huge lapse on your part. Foster Mohale, a spokesperson for the health department, speaking to us about the Matthew Lani saga. His lawyer or legal representative having given an interview today saying, well, he is not a doctor, has never claimed to be, yet he made videos saying he was. So, who to believe?
And he's caught with a pair of stethoscopes at Helen Joseph Hospital.
He literally made videos, and he's going to court tomorrow, where he said, he insisted after people online said he wasn't a doctor, saying he was indeed registered. And now here we sit tonight with a word from someone who is apparently his legal representative saying that he did not impersonate a doctor. We'll track that story for you here on Newzroom Afrika when it goes to court tomorrow.